push. You're hoping for good things, and they just haven't happened that way.
Oh, my. Tap is on the ground. Molina comes in to score.
For anyone who is physically active in high-risk or contact sports, such as rugby, football, softball, baseball, or soccer, you may have some familiarity with concussions, either through personal experience, observation, or were just warned by a coach or athletic trainer to come to them if you ever hit your head really hard. An old way of thinking was that if you weren't broken or bleeding, you could keep playing. However, we now understand that concussions are a serious matter and can have lasting repercussions on an athlete's playing career and brain health.
It's not the way it was supposed to end for George Smith. My goodness, he took a terrible blow there.
Thankfully, after many years of research, we are able to understand concussions, what causes them, signs and symptoms to look for, how to reduce their occurrence, and what we can do to treat them.
Hi, my name is Jade.
Hi, my name is Gabriel.
Me and Gabe are going to show you all about concussions, how to minimize them, and what you can do to treat them.
A concussion is a mild traumatic brain injury that occurs as a result of a direct blow or sudden snapping of the head forward, backward, or rotating to the side. A direct blow is when an athlete is struck in the head by some object such as a ball, bat, lacrosse stick, or another player. A direct blow can also be when an athlete is moving his strike first to the ground or a goalpost.
Although we know that a concussion can happen to anyone, it is most common for individuals that participate in high-risk or contact sports to sustain one. Also, according to National Athletic Trainers Association research, 58% of all sport-related concussion visits to emergency services are for children ages 8 to 13 years old. Concussions, or mild traumatic brain injuries, are many times unreported and leave the player or participant 1.5 times more likely to sustain a second concussion.
Signs and symptoms of a concussion are headache, nausea, vomiting, problems with balance, sensitivity to light or sound, ringing in ears, loss of consciousness, doubled or blurred vision, amnesia, confusion, problems with concentrating or feeling fuzzy. If an athlete has any signs or symptoms such as decreasing levels of consciousness, increasing confusion, increase in irritability, loss of or fluctuating levels of consciousness, numbness in arms or legs, pupils becoming unequal in size, repeated vomiting or seizures, refer them immediately to the emergency department and bring them to the hospital for emergency care. Once diagnosed with a concussion, a player must not be allowed to return to play until cleared. Once diagnosed with a concussion, a player must not be allowed to return to play until cleared by the physician. Player must rest and not do any physical or mental activity. A comprehensive medical management plan should be implemented that follows concussion policy and includes communication among all that is involved, such as family, school personnel, school medical personnel, and community references. If possible, patients should avoid taking medication containing aspirin or non-steroidal anti-inflammatory drugs. During the acute stages of injury, avoid consuming any substances that can affect the central nervous system, such as alcohol or narcotics.
As we all know, concussions are not 100% preventable. However, many efforts are being made to reduce the chances of receiving a mild traumatic brain injury. Safety equipment and helmets are being improved, and parents and coaches are getting more educated on the topic. In addition to these efforts to decrease the possibilities of mild traumatic brain injuries, athletic trainers also take preseason baseline tests in order to establish an athlete's normal. Having these baseline tests available help the athletic trainer to diagnose a suspected concussion more quickly. Once a concussion is properly identified, treatment can begin and the player can soon return to play. I spoke with my athletic trainer, Brittany Bingham, from Sport Clubs, who had this to say about baseline testing and returning to play.
Well, the number one thing that we do is as soon as somebody shows signs and symptoms of a concussion, we remove them from play. We want to decrease the risk of a second impact, which can cause them further brain damage and complicate any that has already occurred with the initial injury. Okay. People tend to forget that the brain, while it is encased in a skull, it sits in fluid. So it moves more than what the skull moves. So if you take into account acceleration and the mass at which someone gets hit, so your head's moving at a certain speed, but your brain inside is moving even quicker because it's sitting in water. So there's nothing protecting the brain from banging around in the skull. Generally, the number one thing that we can do for anybody with a concussion is rest. So our return to play protocol is created with our team physician, and it consists of as soon as you're removed from play, within 24 to 48 hours, you should be following up with the team physician. You should also have undergone a post-injury concussion assessment test, which you also have the baseline done prior to participation. That is compared to your prior participation, your baseline, so that we know exactly where you're at. Once you see the doctor, depending on the symptoms, he will recommend a certain number of days or time frame in which to wait before we begin any type of testing or return to play protocol. So generally, we wait 24 to 48 hours post your last symptom. So you have to be asymptomatic before you can start any type of stress testing. So generally, we start with a stress test, which kind of raises your blood pressure, raises your pulse, and increases the stress that your brain is under without putting you in a game situation or a practice scenario. And it allows us to see how your body adapts to those changes. And if you develop symptoms from that, then we know we still need to wait. Okay? If you're asymptomatic following stress testing, usually 24 to 48 hours again, then we start our return to play protocol where we work you into practice at a certain percentage. And then each day that you're asymptomatic, the percentages increase until you're back to a full return to play.